Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years, and you're listening to Ask Dr. Leila. Anything you need to know about dentistry. We're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile. A very warm welcome to all of you out there. Happy March. And almost in just over a week, spring begins. And spring is all about new beginnings and transformations. Think of it as a season that symbolizes starting fresh and starting over. I'm particularly excited about spring coming. Anyways, today's topic, I want to go right into it. It's about mouth breathing and your dentist and what role your dentist has in picking up the fact that you or your child is a mouth breather. As humans, we are obligate nasal breathers, but mouth breathing has become prevalent and almost the norm. The dentist can play an important role in reversing this trend by both diagnosing and treating. The airway encompasses the mouth, jaw, nasal passages, tongue, and throat. Dentists, in collaboration with other health professionals, can recognize the early signs of this disorder, perform proper assessment of facial and dental structures, and provide treatment to help prevent and manage the dysfunction. Therefore, it is of interest to discuss the impact of airway development and dysfunction on dental health. It is normal for people to breathe through their nose. Nasal breathing warms and humidifies incoming air and filters contaminants. Mouth breathing, on the other hand, may seem like it is not a big deal because it is necessary when you have nasal congestion or are exercising. But it can be a significant concern when it comes to your oral health and even facial development in children. If you notice these symptoms in yourself or your child, please make an appointment with your dentist to find out if mouth breathing is the cause and discuss the solutions. Chronic bad breath, cracked lips, sinus and ear infections, snoring, frequent colds, dry mouth, swollen and red gums that bleed easily, cavities, and teeth sensitivity. Although mouth breathing can be habitual, it is typically caused by temporary blockages in the nasal passage. Some reasons for mouth breathing can include nasal congestion due to allergies, cold or sinus infection, deviated septum, enlarged tonsils or adenoids, small jaw, obstructive sleep apnea, nasal polyps, stress and anxiety. When your dentist identifies the cause of your mouth breathing, they can work with you to develop a treatment plan for managing the condition. Your dentist is often the first to identify the signs and effects of chronic mouth breathing. The physical effects of frequent mouth breathing can take various forms. Mouth breathing can significantly affect your saliva production. When you breathe through your nose, your sinuses add moisture to the air you inhale. So when you breathe through your mouth, you are at an elevated risk of experiencing dry mouth. Dry mouth increases the acidity in your mouth, putting you at greater risk of developing tooth decay. People with dry mouth are more likely to develop tooth decay along the gum lines due to a lack of saliva protecting the teeth from acids. The inner dentin layer of your tooth is not as resistant to acidity as your enamel. Without saliva to wash away harmful mouth bacteria, you are more likely to experience gum disease. In its earliest stages, gingivitis is reversible under the supervision of your dentist and an effective at-home oral hygiene routine. However, if gum disease is left untreated, it can advance to periodontitis, which not only causes tooth loss, but is also linked to health problems like diabetes, stroke, and respiratory issues. Chronic mouth breathing occurs in approximately 10 to 15% of young children. It can cause structural deformities like a longer and narrower face, known as long face syndrome, a flatter nose, weak cheek muscles, and a high palate. Poor facial development due to mouth breathing can also cause malocclusions like an open bite and cross bite and overcrowded and impacted teeth. Pediatric mouth breathers may also exhibit swallow abnormalities and speech deficits. And a 2014 study found that convex facial tissue and a higher degree of lip separation were more prominent in children who were chronic mouth breathers. If you have symptoms that indicate you're frequently mouth breathing, it's a good idea to book an appointment with your dentist to find out what's causing it. Long-term mouth breathing can have adverse effects on your oral health. There are several differences between breathing through your mouth instead of through your nose. I want to go into a little bit more detail on this. When you breathe through your nose, tiny hairs called cilia filter out debris like allergens, pollution, and even small insects. Your mouth doesn't offer that protection. Your lungs and throat function better with moist air. Your nose has bony structures called turbinates that handle that task. Air you take in through your mouth is drier. Likewise, your throat and lungs thrive on warm air. When you breathe in through your nose, the air you take in gradually warms up until it's closer to body temperature, making it easy for your tissues to absorb. Mouth breathing is something you do. It's not who you are. It's not a question of being good or bad. It's about which way of breathing is most helpful and healthful. Breathing through your nose instead of your mouth is better on both counts. Just to reiterate, many mouth breathing symptoms affect children and adults the same way. Here are some examples. Dry mouth. Breathing through your mouth as you sleep dries the saliva that keeps your mouth moist. Bad breath. Mouth breathing affects saliva flow that usually keeps your mouth clean. Drools on pillows. Saliva that usually collects in your mouth seeps out from your open mouth. And malocclusions. Malocclusion happens when your upper and lower teeth don't align. Some tests your dentist and healthcare providers may use include the lip seal test. This test evaluates whether you can breathe with your mouth closed. The mirror test, your healthcare provider holds a mirror under your nose looking for clouding or condensation that indicates you're breathing through your nose. And the water test. This test checks your ability to hold water in your mouth, and our orthodontist usually does this one. So remember this, you can't keep children from breathing through their mouths, but you can help your child so they don't make mouth breathing a harmful habit. And some suggestions are watch out for runny noses and other signs of nasal congestion. Children who have chronic nasal congestion are more likely to develop mouth breathing. And check your child's sleeping habits. If they're restless sleepers, they snore, or they mostly breathe through their mouths when they are asleep, they may be developing mouth breathing. If your child seems to be breathing through their mouth more than their nose, ask your dentist and your healthcare provider to evaluate for mouth breathing, including the physical problems that may keep them from breathing through their nose. As with children, you may not be able to prevent mouth breathing, but you can get help to stop mouth breathing before it causes problems such as bad breath and restless sleep. As a standard of care, an airway questionnaire and physical examination should be completed on all new and existing patients. If an airway dysfunction is suspected, the patient should be made aware of the risk and benefits of treatment. Referrals to an airway-centric dentist, airway-centric orthodontist, ENT, myofunctional therapist, oral surgeon, allergist, and sleep MD should be completed. It is imperative that healthcare professionals use a strong team-based approach to manage all aspects of the patient with underdeveloped airways. In-depth education on airway dysfunction should be implemented at the graduate school level and in continuing education courses for all healthcare professionals to promote collaborative treatment. Thus, with education, early intervention, and collaboration, we can help patients to live long with a healthy life. Thank you for listening to us at the Ask Dr. Leila. As always, any questions, concerns, or any ideas or anything you'd like for us to talk about, please reach out and we will definitely get back to you. And for now, have an awesome week ahead, everyone, and talk to you guys soon.